Hi, welcome to this month's newsletter in what's quite an exciting month for Healthwatches as we're celebrating our 10-year anniversary. So that's 10 years since Healthwatch was established across England to be the independent voice for people who use health and social care services. So what have we done in the last 10 years? We've supported over 1,500 people to find support. We've had views from over 13,000 people. And we've written over 50 reports on issues that have been really challenging for our citizens. So things ranging from what's going on in our local hospitals, experiences on certain wards, how you're struggling to get access to GPs, dentists, mental health, autism, social care inspections, a really wide range of matters that are important to you. So I've just mentioned some of the work that we've done and the impact that we've made in Bradford, but as part of a national network, Healthwatch England has been able to work at a really strategic level, right up there with central government and the big policy makers around serious concerns such as dentists. We all know at the moment people are really struggling to get an NHS dentist. We can do what we can in Bradford, but as part of a national network, we're able to share that experience that you tell us about. So on a daily basis, we get phone calls and emails about the struggle that people are finding in accessing a local dentist. That information is shared with Healthwatch England, which is then part of a larger network, and that information can be used to influence whole-scale change on a national level with the hope of making dentistry so much more accessible for us all. So even though it's our 10th birthday, we're not having a big celebration with cakes and balloons. The cost of living crisis, NHS staff on strike, and the system still getting back to normal after the pandemic for those of us who use it and those people who work in it as well. So what we are doing to celebrate the Healthwatch anniversary is saying thank you to those Healthwatch heroes, those people who have taken the time to share their experiences of using health and care services with us, and also those people who work in the system that make the decisions, that deliver the services, who are really passionate about hearing what you've got to say and doing what they can to make things better. What we're a little bit worried about though is that at the moment we're creating a review culture in the country, and we've seen some stats that say 84% of people are likely to leave a review for a restaurant or a hotel, whether you've had good or bad service, but not doing the same when it comes to your health and care services. So whilst 1 in 10 people say they will be willing to leave a review of health and social care services, that's 9 out of 10 who say there aren't, and that concerns us a little bit. Some of the reasons we think that might be the case is that people might not want to be identified or think it could affect the quality of their care. That really isn't the case, and by contacting us at Healthwatch you can be anonymous, we're independent, and we can put your views across to people who I can guarantee are listening, who really want to listen, and we can do that on your behalf. You can contact us at any time that's convenient for yourself. We can do things over the telephone, by email, or if somebody would prefer someone to actually come out and chat to them about something that's really significant, that's an option as well. So whilst we always want to hear about everything, what we're particularly interested in at the moment are your experiences of end-of-life care, and obviously that's a really sensitive topic. So if somebody would like us to come and have a one-to-one conversation with them, come and visit people in your own home, that's absolutely doable, and we appreciate the value in that. And something else we're working on is children's mental health. We know there are some real challenges around accessing services for children and young people, and we'd like to hear again what's working, what isn't working, how it could be better, because I'm in a position now where people are asking me what's going on and how they can improve it. So if you tell us, I can tell them. I'd like to take this opportunity to wish Eid Mubarak to those of you celebrating in the coming days.